Tonight, hospital beds in the metro have been filling up.
The most critical ICU beds are at 93% capacity. Our Liliana Pearson joins us now with what this all means. Liliana.
A key to finding out what's going on can be actually found in these two graphs right here. Here you can see that hospitalization in the metro is steadily going up. But it's good to know that these hospitalizations aren't all COVID related. But you can also see over here in this graph that COVID cases aren't on the rise. It's alarming when you see 88% of medical and surgical beds are full and 93% of ICU beds are full. But CHI says not to panic.
We've been 93% occupancy off and on for years. I mean, that happens all the time. That's a steady state for us.
Both CHI and UNMC say it's an occupancy rate they can comfortably handle right now because there isn't an overwhelming number of COVID patients. In the metro, 129 people are hospitalized because of COVID.
We look at the data every day and quite frankly are at this point not concerned.
The reason so much attention is given to hospital occupancy is because if there is a sudden spike in cases like we've seen recently, it could mean there might not be enough beds if there is a sudden rush of deathly ill people.
The assumption that if you get sick that we're going to have a hospital bed for you is a false assumption. We can fill.
UNMC doctors are warning the combination of a flu season and rising COVID numbers could be bad.
The thought of having a flu season and a COVID-19 pandemic on top of it at the same time makes us extremely uneasy.
But colleagues at CHI are feeling more at ease when it comes to flu. Some countries in the southern hemisphere experienced a mild flu season over the winter, which just wrapped up.
Everybody prepares for these, these surges in demand, and that's what we do in healthcare. So I'm less worried about it.
CHI and UNMC say they have multiple ways to expand their ICU bedding. What capacity they are counting now only accounts for their day-to-day setup. John, Sharon?
I think Liliana